Now to the other major news just before we came on tonight. The CDC on booster shots clearing another major hurdle at this hour. Late today, an independent CDC advisory panel voting unanimously to recommend boosters from Moderna and Johnson Johnson now. Boosters for all three vaccines now in this country, and the panel also paving the way to allow mixing and matching when getting your booster. Tonight, only one step left. CDC Director Dr. Rochelle Walensky must sign off. Every indication that she will, and quickly. And that means millions of Americans could be getting their boosters by this weekend. Dr. Ashish Jha standing by to answer your questions in a moment. We'll ask him about mixing and matching. But first, Whit Johnson here and what this key CDC panel just decided.
Tonight, those long-awaited recommendations for Moderna and Johnson Johnson booster shots, along with guidance for Americans considering mixing and matching boosters.
Vote number 1 passes with 15 yeses and 0 nos.
For people who got the Moderna vaccine, a CDC panel today voting unanimously to recommend a booster shot at least 6 months after vaccination for people over 65 and any adult whose health or work puts them at higher risk. And for the 15 million Johnson Johnson recipients, a second dose recommended at least 2 months after vaccination for anyone over 18. The panel also allowing Americans to have flexibility to choose a different vaccine brand for a booster.
Well, I think we've gotten more clarity because it's leveling the playing field across all three vaccines. Now there's an openness to boosting no matter what vaccine you got, but there's still some confusion.
So many have been looking for guidance on booster shots.
I would like to talk to my doctor just to be informed.
The recommendations raising questions for people who got the Johnson Johnson shot after a limited study suggested they might benefit more from an mRNA booster, meaning Pfizer or Moderna. For those given an extra J&J shot, antibodies rose 4-fold. But a booster with Pfizer sent those antibodies up 35-fold. And with a Moderna boost, they jumped 76-fold. Still, no evidence yet that mixing leads to greater long-term protection. In Chicago, Nathan Bean got the J&J 1 shot and experienced a breakthrough infection 4 months later.
Night 2 of coronavirus.
After talking with his doctor, Nathan's planning on getting a Moderna booster, saying he wants to take every precaution before seeing his mother, who is immunocompromised.
I was excited to be able to get this Moderna shot. We're going to be able to celebrate Christmas and just celebrate being with each other for the first time in 2.5 years.
And Whit Johnson back with us here tonight, and Whit, with a sign-off expected very soon from the CDC Director, Dr. Rochelle Walensky. Then how soon before we see these boosters rolling out across the country?
David, some people will be able to go out and get these booster shots as early as tomorrow at pharmacies, vaccination sites, or doctors' offices across the country. The White House insists there is enough supply in the pipeline for all eligible adults to be able to go out and get a booster shot when they need them. David.
All right, Whit Johnson on the breaking news from the CDC. Whit, thank you. We know many of you at home have questions tonight, so let's bring in, as always, Dr. Ashish Jha, Dean of the Brown University School of Public Health, back with us tonight. Dr. Jha, always great to have you with us. Really, two key questions here tonight. First, we know you've been saying this here all along the way that these vaccines are working, the efficacy holding up pretty well. But what does the data show already? How much more protection do you get from these boosters?
Good evening, David. Yes, thanks for having me back. The boosters are really helpful. While the vaccines are working well in preventing severe infections, we are seeing breakthroughs, and we see very clear evidence now that boosters, especially for high-risk individuals, make an enormous difference in reducing those infections.
And I wanted to ask you about this small study that we've been reporting on here this week involving the Johnson Johnson one-shot vaccine. This particular study shows that mixing and matching with an mRNA vaccine, Pfizer or Moderna, one of their boosters, and that the study actually saw significant results. Do you suggest considering this?
Yeah, so what we know about mixing and matching is the following. First of all, it's very safe to do. Whatever set of vaccines you got first, you can get a different vaccine as a booster, and it's going to work fine. I don't think we have long-term follow-up that says that one is better than the other. So as far as I'm concerned, if you want to mix and match, that's fine. If you want to stick with the original, that's perfectly fine as well.
Dr. Jha helping us to break through it all once again tonight. Always great to have you, Doctor. See you soon.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.